Aside from trauma, such as falling and injuring yourself or having something heavy strike your hand, there's really only a few things that typically cause pain. We're going to leave out cancer because cancer almost never occurs in the hand or in the extremities unless a person's got metastatic disease, and the likelihood of it coming down to the hand is not great. Okay, so we check people with x-rays when that's necessary, but let's put that all aside. The most common thing to cause pain in a person's hand, other than carpal tunnel syndrome, is trigger digit can bother because the finger can get stuck as the tendon's thick and gets pinched by a tight band in there. A very similar process, which hurts a lot more, is called Quervain's tendinosis, which is irritation of the tendons on the thumb here, on the radial side of the wrist. So the person will hurt over here on this side of the wrist. So it's very localized. A little less common, or I should say much less common, is tendinitis of the extensor carpi ulnaris. So we call it the ulnar dorsal wrist. Those are really the main things. One other thing that's a fairly common is a Dupuytren's nodule. Dupuytren's contracture is a disease that affects men and women almost equally. It's a genetically transmitted disease. It's autosomal dominant with incomplete penetrance, so it can skip a generation or two and then show up. So the family might not have been aware that somebody in the family had it because it's 2 generations before. It's almost exclusively identified in white people and Japanese, unless there's a mixed marriage. So you're not typically going to see it in Hispanic people, etc., unless there's a mixed marriage there. But that can start out as a very tender nodule in the palm, or more uncommonly in the finger. And the people will come in maybe thinking they have a cancer or something. But those are the main reasons of a non-carpal tunnel pain. And so you see, localized pain here, or in a finger, that's not typical of carpal tunnel syndrome. So a person comes in with carpal tunnel, they're going to be more vague. My whole wrist hurts, my whole hand hurts, my whole palm hurts, my palm of my fingers. I have continuous numbness or continuous tingling. And then people are really in tune with their body. It gets numb up to this half of the ring finger. And some people, it awakens me every night. I try and dangle my arm off the side of the bed, shake it out, and etc. So it's pretty clear when somebody's got a nerve problem versus when he's other things. A lot of people have more than one thing going on. So I scrutinize each person by checking grip, pinch, sensitivity of the fingers, and then if it's appropriate, x-ray or a nerve conduction study. A very common complaint for pain in the hand is arthritis at the base of the thumb. Arthritis within the fingers usually doesn't hurt. And when it does, it's usually the index or long finger knuckles. It's not typically the end of the fingers where you'll see somebody have so many deformities. And I think it's because the amount of force in the joints of the hand is so much less than other joints. But interestingly, the arthritis at the base of the thumb, which occurs more commonly in women than in men, usually when people end up coming in to be treated for that, they're about average age of about 55 or 57, somewhere in there. But half or more of those people have carpal tunnel syndrome at the same time. And so there'll be overlapping of symptoms. We have to very carefully examine the person and probably treat both things at the same time to give them the relief that they want.